Is that okay with everyone?
Yeah.
Yeah. Okay, folks, can I introduce our speaker for tonight, Cathy Berresford?
Thank you, John. So can you enable it so that I can share my screen? Yeah, brilliant.
Yeah, we're going to
Okay,
do this. That's it there now. That should be working for you.
perfect. Okay. Okay, bear with me. I'll just make
Yeah.
sure I can do it from the slideshow. Sorry, it's just because I'm not used to Zoom.
Zoom.
I can't. Oh, here we go from the beginning. Right, perfect.
Great.
Get the technical bits. They're the worst bits, aren't they? Can you all see my screen? Yeah.
Yes.
Well, that's a great start then. Okay, thank you so much for giving me the opportunity to come and speak with you this evening. I really do appreciate it and value your time, especially I know it's the evening, so that's really fabulous that you've come. And I'm not going to speak for more than half an hour, but hopefully I'll make it informative for you and you'll enjoy it and you'll learn something and maybe you can teach me something too at the end when you ask questions and stuff. So, as John said, I'm a nurse and a PhD student, and the research that I'm doing is looking at experiences of care in advanced liver disease. And it's a PhD research study that's match funded by Bournemouth University, where I'm a student, and Lewis Manning Hospice Care in Dorset.
Mm-hmm.
And I've got three supervisors who are overseeing the work that I do and meeting with me regularly. Doctors Leslie Gelling and Dr. Sue Barron. They're both nurses and senior academics at Bournemouth University and very experienced in research and doing a great job of supporting me. And then in terms of a more clinical perspective, I've got Dr. Jackie Dominy supporting me. She's a GP and she's part of Lewis Manning Hospice. So, what am I going to talk to you about today? For my agenda, I thought it would be useful if I gave you a brief overview of my background. So, who am I? A background to the project so that you can understand more about how it came about. I'm going to talk to you briefly about the findings of the systematic literature review that I had to do, and I'll explain what that means as well. I'll talk to you about my progress so far. And then I'll talk about how you or people that you know can get involved if you're interested. So, my background, who am I? So, I've been a registered nurse since 1998. So, I've got more than 25 years of clinical experience in a range of different environments, including hospital, with people who are in hospital, in hospice, in the community as a GP practice nurse. And most recently, I've actually been a diabetes specialist nurse, which I have 14 years of experience in. Now, that might come as a bit of a surprise to you. I am not somebody with a specialist background in liver care. So, you might be thinking, well, why are you doing this particular project? There's loads of reasons why I'm interested in this project personally and professionally. But there is crossover between diabetes and liver disease, as some of you may be aware. And they're both long-term conditions which people need support to manage. And I have a lot of experience of that. I do still do some clinical work as a diabetes specialist nurse, but my PhD is full-time. So primarily I'm focusing on that at the moment. I'm an advocate for person-centered care. Well, what does that actually mean? So person-centered care is an approach that prioritizes the individual's preferences, needs, and values in making decisions about their healthcare. So in other words, it's about recognizing a person as a unique individual and finding out what matters to them when providing healthcare. And that's something that I've always tried to incorporate into my clinical practice as a nurse. And I have also been involved in previous research projects to the PhD and written some papers where I've included this. So this is something that I feel also connects well with this particular project. I'm passionate about public involvement, and that's one of the reasons why I'm here today sharing what I'm doing with you, because I know that it's incredibly important. But what do I mean by that? So as you may well know, public involvement in research means research being carried out with or by members of the public rather than to, about, or for them. Now, this seemed particularly important to me when I started out on this research project, because I don't specialise in liver disease, as I've said, and I don't have liver disease. So to make this research meaningful to people and for it to be credible and valuable, I appreciate that I need to be making sure that I'm working with people who have got liver disease. I want the study to be meaningful to people with advanced liver disease and the people who are involved in their care. So let me just give you a bit more information about the background to the project, because I appreciate you might still be wondering, well, how did I get involved with it? I saw it advertised and I thought, wow, what a fantastic opportunity. The project's born out of a collaboration between Lewis Manning Hospice Care in Dorset and Bournemouth University. The two have already worked together on other projects, and the trustees of the hospice, some of whom are pictured here, were keen to provide this opportunity for a PhD focusing on liver disease. Professor Howard Thomas has a background as a hepatologist. He's retired now, so he was particularly keen to support this. So when I saw the opportunity advertised, I knew it would be a brilliant opportunity for me personally and professionally, because I would get new skills in research, developing a project, working with other people, being part of a university. But most importantly, I was particularly keen on the fact that it was giving a voice to people affected by advanced liver disease, with a view to improving care where appropriate, sharing good practice, learning more about what's important to people. So the PhD is full-time and it's for 3 years. So I'm in my second year now. In September, I started year 2 of the project. Now, interestingly, there's my doorbell, as I said. Interestingly, at the point at which I applied for the project, the focus was specifically palliative and end-of-life care for people with liver disease. And I'm going to talk a bit more about that and explain a bit more. But why was this an important issue in the first place? Well, I'm probably, preaching to the converted, because you're all here and you know what the issues are for people with liver disease. That's why you're here. But just to touch upon why it was considered an important topic for research. As you will be aware, rates of liver disease are increasing in the UK. The Office for National Statistics shows that levels are continuing to rise, and it's also a major cause of illness internationally. And as I expect many of you are aware, the main causes are alcohol-related, fatty liver disease, hepatitis B and hepatitis C. I'm focusing on individuals who've got liver disease as a primary condition. So what I mean by that is not secondary. Secondary could be, for example, if they've got liver metastases caused by a different type of cancer or something like that. Not focusing on that, because the care pathway is likely to be very different to somebody who's got a primary diagnosis of liver disease. For the focus of this research, I'm working with people who've got what's called decompensated advanced liver disease. So you may already know this, I appreciate some of you will, but in decompensated liver disease, the liver cannot carry out its functions properly. I mean, if you consider that the liver is responsible for more than 500 jobs in our body, it's a complex organ, it's vital for life. And in the decompensated situation, we know that the liver isn't able to do what it usually would do. And so I understand from people I've been talking to and from what I've been reading that that can make it challenging to live with at that point, because it causes difficult symptoms, emotional and social issues for people who are living with it and their families. So, palliative care can be offered at any stage in liver disease to ease symptoms, emotional and social challenges for people who are experiencing it. But there can be a lot of confusion around the term palliative care because it's often associated with end-of-life care. So increasingly, the term supportive care is being used because of that assumption that palliative care is only for people when they're at the end of life. And I completely understand why there's that confusion. It is a bit unclear sometimes. I mean, even if you look at this definition, the active holistic care of individuals across all ages with serious health-related suffering due to severe illness, and especially of those near the end of life. It aims to improve the quality of life of patients, their families, and their caregivers. But the key thing about palliative care is, although it may well be towards the end of life, it doesn't have to be. And there's a big movement in liver disease that people should be having access to that more supportive care that helps with symptoms, the emotional, the social aspects throughout their journey of having liver disease. How is that different to end-of-life care? End-of-life care is specifically treatment, care and support for individuals who are thought to be in the last year of life. But that's often very unclear. It can be ambiguous. Liver disease can have an unpredictable trajectory. It's not always clear at what stage somebody's at. Things can change quite quickly. And that was quite apparent from some of the research that I've looked at and the people that I've been speaking to as well. So, in the first year, when you do a PhD, you're expected to do something called a systematic literature review. What that involves is collecting research and papers and summarising them. So looking at what research has already been done on a topic and summarising them to answer a research question. So in view of what the project was at the very start, I looked at the research available to find out more about the experiences of people with advanced liver disease, focusing on palliative and end-of-life care in the UK. So that was the focus when I did my systematic literature review at that point. So it was a big piece of work. I started it a year ago, took quite a few months to finish. I had support from the librarian at the university because it's quite complicated for trying to find all these different papers. Found over 6,000 papers that were in some way relevant to the question and the experiences of people with liver disease and palliative care and end-of-life care. But once I was sort of sifting through all the papers and honing it all in and looking at what they were about and how, did they answer this question, it actually came down to 5 studies that did focus on experiences of people in the UK of palliative and end-of-life care. And what I found based on these papers was that, and I'm sure this isn't going to be a great big surprise to many of you, but the experiences of people with liver disease of palliative and end-of-life care depended on 4 main themes. So the first one was related to healthcare professionals and the quality of relationships that people had with healthcare professionals. So there was a particular emphasis on the role of GPs, which isn't surprising because that's often people's first port of call, and specialist nurses. But there were conflicting experiences and perspectives regarding healthcare professionals. And it depended on things like the way services were structured, healthcare professionals' communication skills, clinicians who were responsive, well-informed, and person-centered improved care experiences. And so that was quite clear in the papers that I found. The second theme was more to do with the structure of services. And that related to aspects such as where care took place, access to services, and also access to specialist and palliative and end-of-life care services, and whether or not people were getting access to those services. But things like whether or not people were having to be admitted to hospital. For example, if they had ascites, which is the buildup of fluid in their tummy, where were they getting that drained? Was it easy for them to get to that place? Or did the service come out to them? Because some people were having it done at home. Were they having to travel far? Were they having to wait around? Were they having to be admitted and spend days in hospital? Was it difficult for them to arrange this kind of service? Did they have access to specialists? It all made a difference. The next theme was in relation to support. And people with liver disease, their carers as well, received support from a variety of sources, but there were some barriers and some facilitators to this. So things like knowing how to access support in the first place, poor care or communication from healthcare professionals, constraints from services, for example, time-limited appointments. They were some of the barriers. The things that made a difference were regular contact with staff who knew what they were doing, having easy access, for example, telephone support, having access to specialist nurses, knowing where to go for support, coordinated care, and having supportive friends and family, because the role of carers in terms of people's family partners was clearly very important to them. And there's a whole lot of other work in relation to people who are caring as well. And that's something that I'm going to be including in this project. Finally, information and communication were really important concepts in terms of people's experiences, and they were interrelated because information or a lack of it was important, but how information was communicated or not communicated was also really powerful as well. So overall, what I found was that experiences could be disempowering to people. So that meant that they felt a loss of control, perhaps weren't being listened to, weren't having choices about the kinds of care that they wanted and information they needed. But on the other hand, it could be empowering, where they did have staff that listened to them, cared about them, supported them, provided information in accessible forms, and they did get the support and information that they needed. So unfortunately, there is still, based on the information that I found, variation in services and variation in people's experiences. So in summary, what I found in the systematic literature review was that people's experiences of palliative and end-of-life care depended on who provided the care, where it was provided, the support they received, the provision of information, and how it was communicated. And all of this very much related again to that concept of person-centered care, where care was centered around the needs of individuals and people were recognized for their uniqueness, it was so much better experiences. So once I finished the systematic literature review, I knew that I had to discuss this with people who have liver disease and people who are carers of liver disease. So I advertised through a national website. Some of you may have heard of it. If you haven't, I recommend getting involved with it because I'm a member myself, and it's a great opportunity if you do want to be in any public involvement activities. I set up a meeting in April so that we could discuss the findings of the literature review and plan this research project moving forward. It was very informative in finding out what people with liver disease and carers thought about the findings and making decisions about how this PhD research project should move forward. So in terms of who I should interview, what questions I should ask them at interview, how I might recruit people, that sort of thing. And I'm very pleased to say that the paper that I wrote for my systematic literature review has now been published in an open access journal called Health Expectations. So if any of you would like to read it, feel free. You can access it online. It's freely available. So I'm very pleased about that, and grateful to the public involvement group who supported me with their ideas as well. Now, something that came out of the systematic literature review, the public involvement meeting, and in my discussions with healthcare professionals was that sometimes people with liver disease and their carers were not clear when care they were receiving was palliative or when it was end of life. It was very unclear. And actually, healthcare professionals were not always clear about this either. So for that reason, it became apparent to me that it wasn't appropriate for this research study to be focusing on palliative and end-of-life care experiences. And so the focus of this project changed as a direct consequence of that. So the focus of the PhD research now is care experiences in decompensated advanced liver disease. And I'm specifically focusing on individuals who are not on the transplant pathway, because their care will be different to individuals who are on the transplant list. And the objectives of this research are to explore the subjective experiences and perspectives of people who have decompensated advanced liver disease and are having care, their carers, and professionals who are involved in supporting them, so that I can get a holistic, broad view of what people's experiences are and what's going on. And I'm focusing on the UK. And the second objective, which I've already touched upon, is to embed public involvement throughout the research project. So before you can do any kind of research study like this, of course, you must have ethical approval. So I went through the whole ethics approval. I had support from some of the members from the public involvement group, which was extremely useful because they helped me to be thinking about how to conduct the research in a sensitive and an appropriate way, what sorts of interview questions I should be asking people. And also they looked at the participant information leaflet for me and gave me suggestions about the wording. And I got ethical approval last month from the university and also from NHS. So very pleased about that. So how am I actually going about the research now? So firstly, recruiting people to take part in the study, and that can run through until next autumn. Interviews, which are being held by video call, that can be like on Teams or Zoom. I can do it in telephone and possibly in person. So it depends on the preference of the people that are taking part in the study, and also, of course, on convenience and practicality, depending on where people live. The interviews are generally maximum about an hour. The ones I've done so far, I think the shortest was about 18 minutes and the longest was actually just over an hour. So it depends on how much people have got to say and how much they want to share with me. Once I have each interview, I analyse it using a type of methodology called constructivist grounded theory, which I won't go into detail about today. But it's a way of actually analysing what's coming out of the data and seeing what the themes are. And then once this is all finished, well, and some of it as I go along, actually, it's written up into a thesis, which is a big document, and that's due for submission in September 2025. So I've got lots to work on until then, and I'm keeping very busy with all of this. So progress so far. Well, once I got my ethical approval, I was able to start recruitment. And I've been doing that initially through social media. So Facebook, Twitter, which is now X, WhatsApp. I attended a meeting in October for the British Association for the Study of the Liver. So you may have heard of them. They're made up of healthcare professionals working in liver disease. And I was able to recruit some individuals from that. At the university, I presented a talk to people who have lived experiences of different health conditions to promote the project. I've got meetings with a couple of hospices who work with individuals with liver disease to see how they can help with recruitment. I've contacted another organisation that supports people experiencing homelessness, and I'm trying to think of other ways to reach a range of people, because that was something that came out of the public involvement group meeting as well, was the importance of trying to get a range of voices heard in this research. So who? Well, it's early days. So far, I've been able to speak with a carer for a gentleman who unfortunately did die of liver disease last year. I've interviewed a liver specialist nurse, and I've interviewed a counselling psychologist who works with individuals with advanced liver disease. I've got 4 further interviews scheduled, and I've got a couple of other people who've said that they're interested as well, and I'm just going to confirm them. Now, obviously, it's very early stage in terms of the recruitment and the data collection, but already I can see that what I'm finding does match up with what were some of the themes in the systematic literature review. So, for example, the importance of accessible information for people and how that information is communicated to them, issues around what support is available and where. And I think it's going to be really interesting to see what else comes out of the data. And if you're interested, I'm happy to come back, in a year's time and give you all the updates and let you know what I've found in the research. But, and this is a big but, at this point, I can already see that I must work very hard to ensure that I find ways to recruit individuals who are affected by advanced liver disease and their carers. I got a positive response from social media, but it was primarily from healthcare professionals. And I expect that's because I am a healthcare professional. I've already got those kinds of connections with people. I'm used to liaising and networking with different healthcare professionals. And as I mentioned, I'm not a liver nurse either. So I guess that maybe also makes people a bit more reluctant, perhaps, to come forward. So it is important that people with liver disease and their carers have the opportunity to take part in the study if they would like to share their experiences and have their voices heard when they've got liver disease in the more advanced stages. So do let me know if you've got ideas about how I can promote the research to a range of people, because I'm all ears and I'm, willing to consider different options, because I know that this is really important. So you might be thinking, well, how can we, or somebody that we know, how can people get involved if they would like to? So this is my advert that I shared on social media. More than happy to share it out with any of you so that you can either contact me yourself or share it with other people that you know. And people can email me directly. That's the best way to get in touch with me. Emailing me doesn't oblige you to take part in the research. I'd still have to provide you with a participant information leaflet or explain the research to you if you wanted me to, answer any questions, and also check that the person meets the inclusion criteria for the research. But, please do get in touch. And the other thing is that I'm holding another public involvement group meeting next week on the 30th of November. That's at 10 a.m. and it's on Teams. And if that's something that you think perhaps you might be interested in attending, do let me know. I've got a small group of people coming to that meeting, and if other people are interested in getting involved, they can do. The individuals in the public involvement group don't necessarily have to have advanced liver disease. It's the research itself that people have to have the decompensated advanced liver disease. But for the public involvement group, it's acceptable for people to have liver disease, but without being in an advanced condition with that illness. And if people do want to take part in the public involvement group meeting, you get a £25 Amazon voucher. So you certainly don't have to read all of these, but obviously I wanted to make sure that you had my reference list as well from all the different references that I've included in the presentation today. And a big thank you for listening to what I've had to say. I'm interested to hear your questions and your thoughts about what I'm doing. If you want to send me an email, this is my email address, and also feel free to follow me on Twitter. So I'm going to stop sharing my screen now. Lovely. And I'll open up the floor to any comments or suggestions, anything you've got to say, really.
Great stuff, Cathy. Can you either put your virtual hand up or your real hand if you want to ask a question? And I'll just try and get there. There we go. Gallery. I can't believe there's no questions for Cathy.
Maybe I should ask you guys one then. Well,
I
suppose.
I've got one.
Oh, good. Okay, because I have got questions for you.
Great stuff, Paul. Would you like to introduce yourself, Paul, and then ask a question? You're muted, I think. Yeah.
Hello, my name's Paul Croft.
Hello.
I've been involved with Living Off for quite a few years now. I got introduced to John. I've got liver disease. I've been told it's advanced, stage 3, cirrhotic. But I'm not sure it's a misdiagnosis because I've been listed for a transplant. And when it came to the transplant, I was healthy enough not to need one.
Wow.
And I still haven't had one. My care isn't what I'd call brilliant here. I live in the Lake District and I'm at a general hospital, not on a specialist hospital. I've used the Freeman, or I was involved with the Freeman, but I'm back with the general hospital in my local area, and I'm afraid I don't think they have the necessary skill set for understanding liver disease properly. At the moment, I'm listed for assessment for TRT. I'm suffering certain associated problems with that. Is that something that is a general association with liver disease in men? And if so, what are your experiences of it? And could you enlighten me on whether I'd be able to help you in the trials?
Well, so remember, this isn't a trial, what I'm doing. It's a type of research where I'm interviewing people about their experiences.
Yeah.
So if you're interested in being involved, the opportunity for you might be the public involvement group. In terms of your clinical care, remember as well, I'm not a liver nurse. I certainly can't give you any kind of clinical advice. But actually, even if I was a liver nurse, it wouldn't really be appropriate for me to kind of give you clinical advice in this kind of forum, if you like. But it's interesting to hear what you're saying, because it does sort of fit with what other people are telling me about their experiences, where some things work well and some things not so well. But if you're interested in being involved in the public involvement group, drop me an email.
Yeah, I took an email address.
You got it. Great. Send me an
email.
It down. Send me an email.
Okay, thank you.
Thank you. Thanks for your perspective. That's interesting.
Good. That's good. So Yvonne, you were next.
Hiya, yes, Cathy. I think I'm part of your involvement group anyway, and I'll be there on.
Thank you. I remember.
Yes. I have compensated.
Yes.
Cirrhosis, and it's the MASLD terminology, the new terminology, shall we say? In terms of your research, and you've got a great style in terms of explaining things really carefully, Cathy. But I just wonder, when I'm looking at something in terms of getting involved with, I always look to see what it is that you're actually wanting to get out of it.
Yes.
So how does it translate into action at the end of it all?
I think that's a really good question. And I think one of the challenges at this point is knowing exactly what is going to come out of it. I mean, what I'm trying to do throughout the project is make sure that I'm disseminating as much as possible from the outset. So what I mean by that is doing things like going to meetings and conferences where there are either people like yourselves or individuals who are working in the profession to raise awareness and show what's going on. And that's one of the reasons why I published the systematic literature review, because you don't have to publish it. But I thought, what's the point of me doing this project if I don't then make it available for other people to see and to learn what's going on and to start questioning things? And, you know, it's one thing sort of saying, well, we should provide person-centered care, but then what you want to do is actually show the evidence. Well, what is this actually happening? And if it isn't, what are the barriers to it? So I hope that what I produce will increase evidence and insights into some of the issues, which are then shared with people like yourselves, and also the people that are providing care. And that sort of information is then used, it does sort of translate, filters through to policies in hospitals and in guidelines. And that's one thing that I do see that myself as a nurse, actually. This is one of the reasons why I wanted to get involved with research. So working with individuals who have diabetes, I would often feel frustrated because not with the patients, with the approach, you know, with the one size fits all approach, with the tick box approach, with the rhetoric that we were given, that you're saying that we're going to provide person-centered care, but then actually when you try to deliver that to individuals, when you work in a holistic way, you're told, well, why are you doing that? That's not part of our service. When you do research and you speak to people and you find out what they want, what's important to them, what helps them, it strengthens for clinicians the justification for providing care in a way that is meaningful and appropriate to them. And the good thing is, like when I look at diabetes care, I can see how there's been a shift. And I hope that we'll get the same shift with people who have liver disease, whereby, you know, the way that you talk to people, the language that you use, it matters. And when you've got the evidence to demonstrate that, it starts to improve care. Does that sort of make sense?
Absolutely. That's what I was hoping you were going to say. Because, you know, getting involved with research, sometimes you get involved with research and you don't really know what it is that you're getting out at the end of it.
I know.
It's another set of words that don't translate into actions.
Yeah.
So
sharing it, I think that's so important. You know, look, this isn't this isn't groundbreaking research. You know, it's not going to change everything, but if I can make a difference to the people who I'm speaking with, because already I can see it means something to people. You know, the woman I spoke to who'd been a carer for her stepdad, it meant something to her to share what she's been through. And I feel like that was important because she had the opportunity to, you know, the care hadn't been fantastic, quite frankly, and she had the opportunity to express that. And then if I can use that to sort of say, this isn't okay, or this bit did work well, this is what was good, the more we can build on that over time, when you get other researchers doing the same thing, it does make a difference. And the British Association for the Study of the Liver, they've got this special interest group, which is specifically, they've got lots of interest groups, but one of them is about end-of-life care. And their membership's growing and they're trying to improve things. So that makes me feel positive that there is a shift. I think there's a long way to go, but there's a shift.
You're okay with that, Yvonne? Is that fine? Yeah. Now we had Fiona was first, and then Paula. Did you want to put your hand up again, or was that okay? No, you're okay. Okay, it's Fiona now.
Thanks very much, Cathy. That's been really, really interesting. And I think what really comes through is your interest and passion in person-centered care, which is lovely, so refreshing to hear. But what I was just interested in was what you said about how people often didn't know if the care they were receiving was palliative or end of life. And even the healthcare workers didn't didn't always know.
Mm.
And I'm just wondering, I mean, I understand why you changed the project title to accommodate that, but I was just wondering if you think that's an issue.
Yes, it very much is. And one of the things that's sort of apparent is people not always being clear about their prognosis. Now, that could be there could be a range of reasons. Sometimes people aren't ready to hear certain information, and that's understandable, and they don't necessarily want to ask questions around that. Sometimes healthcare professionals don't know how to have those kinds of conversations, although they themselves weren't very clear, because it can be quite unpredictable. You know, people sometimes can get better when you're not expecting them to, or sometimes they can get worse very quickly. One of the studies that I looked at, there's a researcher called Barbara Kimball who's done a lot of work, and she did a PhD and she looked at people's experiences of living with liver disease. So she looked at it more broadly because she was looking at their whole experience of living with the whole condition. And if you think about the individuals that she worked with, that she did research with, some of them, it went over a year, and some of those individuals died, but some of them got better. You know, it's not always predictable. So that makes it quite challenging. Also, because the thing I said about how palliative care can be a bit confusing and people don't fully understand what it is. So then there's this shift now that we should perhaps be using different terminology. And I can see that that's starting to happen as well. But I think, you know, it will be interesting to see what sorts of conversations the individuals I'm speaking with are having, and what sorts of conversations the people who work with them are having, and what clarity do they have. But yeah, I mean, if I know it's only the first few interviews that I've done, but yeah, already I'm seeing that there are situations where individuals, they don't know what's happening to them, and that's quite worrying and distressing, and it's not right.
Okay, that okay,
Thanks very
Fiona?
much. Yeah, thank
Great
you.
stuff.
Thanks, Cathy.
Now, Pete, you've had your hand up. You'll have to unmute. That's it.
Thanks for that, Cathy. I was just going to ask a question about the transplantation process, and you exclude that from your survey. Having been diagnosed as stage 4 liver disease in 2015, and initially told I was not transplantable, yeah, I lost a lot of weight and managed to get on the transplant list at some point in time, yeah, and was successfully transplanted in 2018. Whilst I was on the list, I received some excellent, what I would say was end of life care.
Yes.
Because you just don't know whether you're going to get a transplant or not. Yeah. So
That's
to all
interesting.
intents, when you're diagnosed with liver cancer, you know, and you know you've only got months left, and you don't know. Some of the care my wife and I received at that time was excellent. Yeah. Appointed a social worker who talked about the practical elements of planning for your death, whilst holding out the hope of you being cured, well, not cured, but treated by a transplant. Yeah.
Yes.
I wondered whether that was missing a trick, rather, kind of thing, because some of the best care.
Yeah, I thought about it a lot, because I think you're raising some really important issues. But the difficulty is that the pathway of care is different. So it can get quite messy when you're doing research. You can have lots and lots of different things that you're looking at. I mean, already the fact that I'm speaking to healthcare professionals, carers, and individuals with liver disease, you could say, well, why are you doing all three? You know, or hopefully you can appreciate why I'm doing that. But, you know, even I have to justify that as well. So I thought about it carefully. I looked at the literature. There has been some work which is exploring the care pathway in terms of transplant, and looked at palliative care as well in relation to that. And actually, after careful consideration and discussion with my supervisors as well, it was felt that it was appropriate to stick with the ones who were not having transplant for those reasons. But that I still will be looking at, you know, because when I write up the results, you have to do a whole discussion section, and you have to look at how your findings relate to other research that's been done. And I will look to see how does what I find compare with the experiences of people who have gone down the transplant pathway.
Okay, thanks.
That
Thanks.
okay, Pete? Happy with that?
Yeah.
Thanks for sharing
Great
your
stuff.
experience. That's
Yeah, that's great.
helpful.
So, Kate, you had your hand up, but no, you're not going to now. So thanks for joining us, by the way, all the way from Glasgow. Very good. So is that it for questions, folks? No one else? Well, thank you so much, Cathy. If you wouldn't
That's
mind
great.
still staying with us, and we'll make
Yes.
the draw to make somebody fabulously wealthy.
And like I said, do get in touch, you know, even if it's just any comments or questions, because no question is going to be silly. You're going to think of things that I won't necessarily think of as well.
Yeah. Well, what I've done is I've screen captured your advert, and we'll put it in our newsletter, which is going out
Thank
in
you
the
so much.
next couple of weeks. So you might get some people from that.
That'll be fabulous. Thank you.
That's good. Okay, I'm going to be blindfold here and pick a number.
If it's for £250.
£250. 114. Can you see that? 114. I'll write that down.
And it's David Bullock from Ashington.
David Bullock from Ashington. Okay, great stuff. You've got £250 to spend. And now, drum roll. Oh, that's a low one. Number 20. This is for £2,500.
Well, it's our goddaughter, Lucy.
Oh, Lucy. Oh, well, that's good. Oh, well, that's
So
great.
she'll be delighted, and I'll be expecting a really nice Christmas.
Actually, she's studying pharmacy at present. So that's good.
Excellent.
And, you know, so that we've got two of them doing pharmacy. So well done, Lucy. Right. The only other thing I want to ask you folks is if anyone knows someone who is a carer of someone with non-alcoholic fatty liver disease, there is an organisation who are willing to pay them to take part in research, and every participant in the research to review the documents, not to take part in research, review the patient information sheet and the documents. If you would review them and you're a carer, they'll give you, they'll pay you, and they'll also make a donation to Liver North for every person who does. So if you know anyone who's a non-alcoholic fatty liver disease, or the new name as Yvonne called it, if you know anyone who's a carer for that, please let me know, and I'll give them your email address, and we get some money for referring you. So that's it, folks.
Just a moment. I don't know whether John mentioned before about the raffle tickets, the charity draw.
I did.
Oh, you did. Right.
Yeah.
I'll be
So
fast.
anyone who wants to join the charity draw, this is the Christmas raffle. We've had some great donations, and we've got an awful lot of prizes now. There are vouchers, and we've got probably about £1,500 worth of vouchers altogether. So that's in the Christmas draw. So if you want some raffle tickets to buy or to sell, I know we sent some out with the newsletters. Let us know. We'll send you some, and you can.
Well, we haven't actually got time to send them now because the free
right.
post address, there's always a delay. But if you do want any tickets, just give me a ring and I'll sort it out.
Yeah, we'll sort it out. Anyway, lovely, Cathy. Thanks so much. That's really interesting. It was off the wall for us because we don't usually have a talk from someone who's doing a PhD. We usually have them who did it 20 years ago.
Oh, okay. Oh, well, I'm happy to come back.
Well, not
Maybe
20
before
years,
20 years, yeah.
20 years. That's lovely. So thanks, folks. And,
all right. Thank you.
We'll not have a meeting before Christmas. So thank you so much for attending. And
thank you.
We'll newsletter coming out in a couple of weeks. All right. Thank you. Bye, everyone.
Bye. Thanks, everyone.